everyone. Welcome to Connected Rheumatology. I'm Dr. Elizabeth Ortiz. For those of you new to the channel, I am a board-certified internist and rheumatologist based out of Dallas, Texas. I see patients here in the Dallas area through my practice, Connected Rheumatology. And here at the YouTube channel, we talk about all things rheumatology, immunology, diet and movement, and mental health and wellness, because we believe it is all connected. If that sounds like something you're interested in learning more about, make sure you hit that subscribe button. So today I'm going to be talking about meditation and mindfulness. Now, I know that there is no way you've landed on this channel without having heard of mindfulness and meditation. But yet there's so many of us who aren't doing anything about it. We don't have any practice. And why is that? Well, it might be, especially for those with an autoimmune condition or with some sort of chronic medical condition, we might think that we are beyond the point where meditation can help us. So what I'm going to talk about is why meditation is especially important for those with autoimmune, inflammatory, or chronic medical conditions. And then we're going to touch a little bit about different practices that you can investigate. So let's get into it. The terms meditation and mindfulness are everywhere, and when we hear those words, we oftentimes kind of conjure up this image of this peaceful yogi sitting on the top of a mountain, you know, with bells chiming and taking deep breaths. And although that is one version of meditation, it isn't the only version. And before we get into exactly the benefits those with autoimmune conditions and other chronic medical conditions can get from a meditative or mindfulness practice, we want to make sure that we're all talking about the same thing. So let's define mindfulness. And I'm going to take out my cheat sheet to make sure I get it right. Okay, so according to the Oxford Dictionary, mindfulness is a mental state achieved by concentrating on the present moment while calmly accepting the feelings and thoughts that come to you. And it's used as a technique for relaxation. Now, we can achieve mindfulness through the practice of meditation. But what exactly is meditation? Well, meditation is simply the practice of focusing the mind in silence. So we can achieve relaxation through focusing the mind in silence, and all of this will make us healthier and calmer. Well, isn't that what we all want? We all want to be healthier and calmer, especially right now. But what exactly will it do for our joint pain, for our inflammation, and for our fatigue? Well, most likely a lot. So let's get into three specifics that meditation and mindfulness can do when you have an autoimmune and inflammatory condition. So number one, it lowers stress, and more importantly, it lowers the impact stress has on our body. So stress, whether it's physical, mental, emotional, whether it's real or perceived, has a physiologic effect on our bodies. It sets in motion this inflammatory and hormonal cascade that gets our body prepped for that fight or flight response. And this response is very useful when we are trying to run from a bear, but it's not particularly useful whenever we are trying to calm down from a day at work. Now, once this inflammation cascade starts, it can be tough to break. Inflammation begets more inflammation, and unless we send our body signals that that inflammation is no longer useful, it can just be an ongoing cycle. Now, granted, every condition is different and every situation is unique. And so there will probably be multiple tools necessary to try to break that inflammation cycle, mainly medications. But meditation and stress management and mindfulness are ways at getting at that stress that medications oftentimes can't. It can be yet another tool to get in and break that inflammation cycle that's run amok. Number two, meditation and mindfulness has been shown to decrease pain levels and improve quality of life. Now, how it does this is most likely very complicated and probably very individual. There's probably lots of different effects on our nervous system, on our hormones, and on our inflammation peptides running through our body. But studies have shown that in those patients with rheumatoid arthritis and other chronic pain conditions, that participating in a mindfulness and meditation practice lowers their pain levels and improves their overall quality of life. Assessing whether or not someone has active rheumatoid arthritis, for example, is reasonably straightforward. We have blood work, labs that we check, we do a physical exam and we know what particular findings to look for, and we can even do ultrasounds and MRIs of joints to look for inflammation within the joint, and all of that can tell us if someone has quote-unquote active disease that needs more medication. Pain, however, and figuring out why someone has pain is much more nuanced and complicated. We don't have a lot of good objective tests that we can point to that tell us why someone's having pain. And this is most likely involved in why we know there is a gap between how a physician thinks a patient's doing and how the patient thinks they are doing. And meditation and mindfulness are a way of addressing the pain in a way that our tests and our medications aren't able to do yet. And number 3, the products of meditation and mindfulness, which we know are things like optimism and vibrancy, those products are associated with longevity. Now, we know that people who suffer from autoimmune, inflammatory, or chronic medical conditions also have an associated higher risk of depression and anxiety. In fact, many of the long-term chronic medical conditions that we just accept as a normal part of aging, things like diabetes, high blood pressure, metabolic syndrome, arthritis, are associated with depression and anxiety. Now, be clear, I am not saying one causes the other. Just because there's an association does not mean there's causation. But we can't ignore the fact that they're associated. And what we have found is that it is the associated mood disorder, so that associated depression and anxiety, which actually puts people at higher risk for low quality of life and mortality. So incorporating some sort of practice is a way of addressing this association in a way that's not an additional medication that brings other side effects and can have profound impacts on the rest of our lives. Okay, I get it. Fine, Ortiz, I get it. I'm supposed to meditate. But how in the world am I supposed to do it? Well, there is no one size fits all. And as much as it would be great if we could all carve out 30 minutes a day to sit on our cushion, cross our legs, and chant, for a lot of us, that's just not our jam. If it is, great. Oh my God, more power to you. But if it's not, don't feel defeated and feel like you're a failure at meditation. There are a lot of other ways to get the same benefit. You can take long walks without a podcast or music. Gardening has excellent meditative effects. Crafts and hobbies like knitting and embroidery and cross stitch are excellent examples. Yoga is an amazing meditation in that it incorporates both breath work and movement. The point of all of these activities is to be focused and to be quiet. I'll be honest, I've tried pretty much all of these approaches. I have tried to sit on a cushion and I could probably get 10 minutes out of it, which is probably all I need. But the idea of sitting on a cushion for 10 minutes a day is just not something I get excited about, even though I know how beneficial it is to my health. I've tried embroidery, I've tried jewelry making, I've tried walks, I've tried cooking, and they all have their benefits, but what I've really gotten into, especially with COVID, is yoga. I think yoga is amazing at the breath work and the movement and the quiet and the focus that it requires of us. And quite honestly, with COVID, I couldn't go to my gym and I needed to do something because being horizontal on the couch wasn't working. And I'm so grateful that I now have been introduced to a real yoga practice. And I really credit it with keeping me sane during truly insane times. So that's my pitch for meditation and mindfulness, and why it's so important to really focus your attention and find a practice that's going to work for you. Like I said, you do not need to sit on that cushion and chant. It's going to look different for everyone. And if all you do is start thinking about it, then that is a step in the right direction. It is just as important as our medication. And so I'd like you to consider this, my prescription for all of you, to take 10 minutes a day and do whatever you are intrigued to do, whatever interests you, maybe something that you haven't done since you were a child, and do it 10 minutes a day for a week. And then do it for the second week. And then maybe on the third week, go up to 15 minutes. And just keep that practice going, and you will be amazed at the changes that you will see. I'm not going to guarantee you're going to get off your medications, and I'm not going to guarantee that you're going to cure your condition, whatever you might be dealing with, but you will feel better. So thanks for watching. Thanks for subscribing. As always, if you like this video, please give it a big thumbs up. It really helps me out. I would love for you to share this with any friends and family who you think can benefit from this message. If you want to learn more, we have excellent resources at connectedrheumatology.com. You can also check us out on Instagram and Facebook. And yeah, thanks for stopping by. Here at Connected Rheumatology, we talk about all things rheumatology, immunology, diet and movement, and mental health and wellness, because you know it is all connected. Thanks, and see you next time.